What are some of the biggest misconceptions we see when it comes to Medicare Advantage plans? Let's dive into it. Now, we have helped thousands of people with their Medicare, and of course, we have given people Medicare Advantage plans. But a lot of times when the discussion starts, we find that many people have a lot of misconceptions when it comes to the Medicare Advantage system in general. So in this video, we're going to go into some of the biggest misconceptions we see and how things actually work. The first misconception we see is that PPO networks cover just about every doctor. To see a doctor outside your Medicare Advantage network, the doctor must accept the terms and conditions, aka the payments from your plan, and often they don't. If they did, they would be in the network already. On another note, some carriers may allow you to see any Medicare doctor out of network and pay out of pocket, then the company will reimburse you. That's much better, but it can take up to 2 months to get reimbursed, and that may not feel so good sitting on a credit card bill or having that money come out of your bank account while you wait for the reimbursement. A lot of people say, oh, it's the PPO network. I can see any doctor I want, and sometimes that is not the case. So remember, PPO network, even though it's advertised as you can see any doctor you want nationwide, in reality, it's usually not the case. Now, the second misconception we see people have is that you can always switch into a Medicare supplement later. Many people, when they first go on Medicare, have a similar thought. I'll take an Advantage plan while I'm young and healthy and save some money, and in a few years, I'll take a Medicare supplement. This may not, however, be a possibility. When you first go on Medicare, you have all potential options at your disposal. You can take any Medicare supplement from any insurance carrier, and you can also take any Medicare Advantage plan from any carrier available in your area, that is, and you can take any Medicare prescription drug plan available in your area. And going forward, you can still take any Medicare Advantage plan in your area or any prescription plan available in your area. But to switch Medicare supplements or to switch from an Advantage plan to a supplement, you will have to answer health questions in most states. The companies who offer Medicare supplements are allowed to look into your health and determine if you are healthy enough to insure. Now, this tends to be for more serious things like cancer, heart attacks, and kidney failure, but either way, no, you will have to answer these health questions. So if you're thinking about taking a Medicare Advantage plan now and then taking a Medicare supplement later, no, it may not be that simple. And a quick note, there are a few states where you can waive health questions. These are states like Massachusetts, Connecticut, and New York. What we just told you is true in most states, however, just not all of them. The third misconception we see people have all the time is that doctors have to stay in network all year long. One of the toughest things that happens to our clients is that their doctors will leave the network of their Medicare Advantage plan in the middle of the year. You may think if your doctor is in network, they need to at least stay there for a calendar year, but it's not the case. The truth is the networks of Medicare Advantage plans are constantly fluctuating. The turnover isn't that crazy, but it is enough for us to let you know. If you take a Medicare Advantage plan specifically because it covers all or most of your doctors, know that this can change at any time. The fourth misconception we see people have is that there aren't any major changes year over year to their Medicare Advantage plans. I can't tell you how many times I've had a new client walk in and they've been in the same Medicare Advantage plan for a decade. Everything has been okay, so why switch? Well, let me tell you. Insurance companies are constantly making new Medicare Advantage plans. These new plans can have better benefits, lower copays, and a more robust network. But the insurance carriers don't always automatically switch you into these new plans. They put the new ones out and send out new materials hoping you'll switch. If you don't, you could be missing out. Every year you should go over your Medicare Advantage plan and see if there's a better one for your current needs. Now, brokers like us do this for you, or you could do some research and see for yourself. Now, we really hope this video helped you better understand the Medicare Advantage system. If you ever need any help with anything Medicare related, visit our website at www.njlifeandhealth.com or call our Toms River, New Jersey office at 848-226-6897. And don't let the NJ and NJ Life and Health fool you. We are licensed in about 20 other states, so chances are we can help you as well. And if you're someone who just wants to learn at their own pace, our YouTube channel has a ton of great other educational videos, so check those out, like, subscribe, and share, and we will see you in the next video.